Good afternoon. I'd like to call the Health and Human Service and Aging Committee meeting to order. Can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Mr. Castleberry.
Here.
Mr. Schlepper.
Here.
Mr. Hauser.
Here.
You have a quorum.
All right, Madam Clerk, anyone signed in for public comment?
No, Madam Chair, no one has signed in.
All right, approval of the minutes from the February 5th meeting. Can I have a first and a second? I'll make a motion to move February 5th. Is there a second?
I'll second.
All right, moved by Conwell, seconded by Schlepper. All in favor, please say aye.
Aye.
All right, we have two items that are referred to the committee today. We're going to skip and go to the second item B. Madam Clerk?
Resolution 2025-0080, authorizing an amendment to a contract with Mental Health Services for Homeless Persons Incorporated, doing business as Frontline Service, for temporary housing for single adults and youth at North Point Transitional Housing, located at 1550 Superior Avenue, Cleveland, for the period January 1st, 2023 through December 31st, 2024, to extend the time period to December 31st, 2025, to amend the terms and for additional funds in the amount not to exceed $1,422,933, effective January 1st, 2025.
Good afternoon, Marcos Cortez with the Office of Homeless Services. Again, this is our second amendment. My apologies, sorry.
Pardon us, we're all trying to turn our phones off.
This is our second amendment with Frontline for the operations of North Point Transitional Housing. North Point provides short-term emergency housing and support for adults and young adults who need to get back on their feet. This program assists residents to achieve permanent housing and steady employment. Individuals come to North Point from shelters, off the street, or after being evicted. The program provides for basic needs such as hygiene products, clothing, laundry services, and 3 meals a day. Services focus on individuals with high barriers to stability, housing stability, and provide wraparound support. This amendment will allow us to extend the time for 1 more year and to add the funding needed for operations. I have Allison Gill here and Aaron Reardon from the Office of Homeless Services who can provide additional programmatic questions or answers to any questions you might have.
Allison Gill, and the other name?
Aaron Reardon.
Can they come up, please? Please all state your names for the record.
Good afternoon, Allison Gill, Interim Executive Officer with the Office of Homeless Services.
Erin Reardon, Senior Administrator, Office of Homeless Services.
We have Shauna with us as well.
Yes, and we have Shauna with us, who is from Frontline.
Shauna Gurley, Frontline Service.
Okay, so my questions would be directed to Shauna. A couple of months ago, we came and did a tour of North Point, and so just wanted to ask, how are the repairs going? Just letting everyone know on the committee that the City of Cleveland owns this building, and we did a tour with some of the City of Cleveland council members, as well as myself and providers, to check on the renovations that had been done to the point, because of at the last meeting, there were several beds that were not being able to be utilized for this population because they needed substantial repairs. So, Shauna, please give us an update on that.
Okay. Well, since that tour, we have not had much more movement in any of the renovations or repairs. We were able to get about 6 more beds online. So now we're at the capacity to serve about 112 persons at the building. However, our building is 152 beds. So there hasn't been much progress at this time. We've had the 4th floor fully renovated, and we're still waiting to hear back about the 2nd and 3rd floors.
Time this contract comes before us, we will committee make sure that we're staying in on the oversight in terms of that. Ms. Gurley, has there been any further conversations, or Allison, has there been any dialogue with the City of Cleveland in terms of where they're at?
Not too much. I think pretty much we've had some more issues during the winter arise, so that has taken a little bit more of urgency with some of our, like elevators and stuff are going down because we've had some significant water issues. So there hasn't been, we've been moving towards what the importance is right now with any of.
Is it a roofing issue?
No, we had a pipe burst, but then also we have extensive plumbing issues. The building is just very old and aged. So we try to figure out which one has more precedence over the other.
Okay, and who would be your, Shauna, who would be your connect? Who do you talk to at the city of Cleveland in terms of repairs?
It would be Marcia Garrett, Commissioner Green, and I believe Commissioner Nagel.
Levine, are you taking notes for me? Okay, I hope so, because I got Marcia Garrett, and you said, is that Commander, or Commissioner Green?
Yes.
And the only reason I bring it up is because we all here want to make sure warm, safe, and dry, and to utilize as many beds as possible, especially during the season. And City of Cleveland is going through their budget hearings right now. So is there a way that you can reach out to Commissioner Green this week and just see when that will come before them or before the council?
Okay, will do.
Allison, how's everything going? Everything going good?
Woman Conwell, Vice President Conwell, yes, everything is going well, thank you. And Shauna, we're happy to assist. Our office is happy to reach out to the city to receive an update on progress, and we'd be happy to pass that information along as well.
Anything changed with this contract internally other than the extension of the time period?
Nothing has changed internally. We still have the same number of persons served. It's still a split between young adults and adults that are working, I believe that is, yes, they're employed, with a focus on housing plans and exit from homelessness.
That's one thing, I've always seen a turnover, a good positive turnover,
Yes,
always. And that's why we want to utilize as many beds as we can, because it's always been a good facility.
yes. It's a high-performing project. Frontline does a tremendous job.
Marcos, has anything changed in terms of verbiage, language, anything in the contract from your standpoint?
No, my understanding is basically we're just extending the time and adding the funding. The funding is flat, is my understanding, right? It's stayed the same. However, it doesn't necessarily meet the needs of the program, but they did get some additional money from the city to operate.
Okay, so have we done our due diligence? And I assume when they say meet the needs, so our contract basically helps with what? Is it administrative cost, programming cost, what exactly?
I'll ask Aaron to step in.
So it covers the administrative costs, program costs, operations. It essentially covers all components.
But when Marco says it doesn't meet the need, is there anything that the county needs to do in this? I'm assuming that they're getting some funding from City of Cleveland and some funding from us. So if the
Correct.
City of Cleveland was, are they up to our rates or?
I mean, we're supporting the majority of this. I mean, we're at 1.4. I think the city, I can't remember the exact amount. I want to say it's like somewhere under 200,000. So we're supporting the majority of it. And I mean, we've had lots of conversations with Frontline about ways to kind of move things around within the existing budget, ways to kind of problem solve. One of the big expenses is food, and that's, we're seeing
Just
that kind
about
of,
to say,
yeah,
it's hurting all our
across the
pockets here.
board. Yeah,
How many meals are we providing there?
3.
So if you need this committee to get more involved in those conversations, please let us know.
Okay, thank you, we appreciate it.
I see that 1.4 and 200,000 is not a easy Easy shake. I want to open it up to my committee members. Any questions that you have?
Just had a question about I'm going to use the word gap here. When you say that there's a gap and there's a higher need, can you just a little bit more clarity about, in a perfect world, what would you need from the county?
I don't know if we've done that, like actual detail work. Obviously, our funding covers the majority. The cities might be filling that gap in. I don't know if that's covering their full needs as well. But we can talk to, work with Frontline to figure out what their actual number is. And then we can get back to you.
I'm just trying to kind of wrap my head around the idea of, what does the deficiency look like? Are we talking about, we need 20% more to cover all of our needs? Or are we talking about this is 100% gap or something like that? So definitely some clarity surrounding that in ways that we can support you even better, because this is critical work for sure.
Yep, we'll get that information to you.
Councilman Hauser?
Just a few quick questions. I'm not as familiar with this contract as the chair is. How many single adults and youth are you guys currently serving?
Okay, so, the most recent count that we have approximately 42 young adults, ages 18 to 24. And then for the adult population, over 18, we have approximately, it looks like the last time was 51.
And then just my follow-up question, do you guys have any performance metrics or accountability metrics in place for the fundings?
We do. We utilize the HUD system performance metrics to monitor every program within the continuum of care. So we look at returns to homelessness, length of stay in shelter. We look at positive exits to housing.
And you guys are working with our other local housing providers like Eaton and Fixing and everything. That
Yes.
sounds good. Well, yeah, to the chair's point, please keep us updated on the great work you guys are doing.
Thank you. We will.
All right, follow-up for me. Is there a written agreement between Frontline and the city of Cleveland?
Outside of like our lease agreement, we have a,
Okay, so you lease, not the lease agreement, more like the policy and I guess something that has to do with the funding that they give. Is this just how it's always been, or is there?
no, so this is a new funding source. So it would be the City of Cleveland CDBG grant that we just received notice for.
So it hasn't been in existence for how long?
This is the first time they'll receive funding.
From the city of
Yes,
Cleveland?
to my knowledge. Yes,
But it's their building?
yes.
All right, any other questions from the committee? Okay. Let's see the dates here. We're extending the time period. Other question, Marcos, is when will the RFP, when will the new, you've extended it. I don't want it to get where we're just extending these
No,
contracts
we
forever.
do
When
plan
is
to
the
issue a
new?
new procurement for this later this year, for it to begin January 1st of next year.
I'm assuming that the dates are, you need second reading suspension?
Yes, please.
All right. So I'll make a motion to move R2 025-0080 to the full council under second reading suspension. Is there a second?
Second.
Moved by Conwell, seconded by Schlepper. All in favor, please say aye.
Aye.
You.
Thank you.
Thank you. Madam Clerk, if you could read the next item into the record.
Resolution 2025-0069, authorizing an amendment to a master contract with various providers for Medicaid home and community-based services for out-of-home placement and foster care services for the period January 1st, 2022 through December 31st, 2024, to extend the time period to March 31st, 2026, to add new providers and for additional funds in the amount not to exceed $83,877,274.99, effective January 1st, 2025.
Good afternoon, David Merriman, Department of Health and Human Services, here with Marcos Cortez as well as Jackie Fletcher. We are here with the final amendment of this master service agreement that funds our board and care contract. As stated, the principal point on this contract is, number one, the cost is increased. We're proposing increases to providers to bring them to the median state level where necessary. The term is also increased from a 12-month term to a 15-month term to get us off a cycle that ends in December and begins in January. We think that'll have an important valuable impact to the annual reauthorization of contracts. We have new providers listed here. And then I just would point out that we expect to re-procure this contract in the future. Later this year, there is also discussion at the state level of some potential state procurement. So we're going to wait and see how that looks as we also assess our what's the best option for us to have contracts in the future that can change with providers' costs, but also quality options. And so more to come on procurement. We heard this in committee last time. I know there were some additional questions that were asked. I know that the director shared answers with council, but we're happy to answer any other questions on this amendment.
Any questions for the committee? I have some, but Sweeney, Councilman.
Thank you, Madam Chairwoman. Director, I just want to say thank you for you and your team. This is a very, very, very complicated and important, and a lot of work's went into it. And I just want to thank you for your efforts and keep up the good work.
Thank you.
Castleberry, did you have some? Okay, I just want to speak to the last point you made. It might not be directly in regards to the Administrator Merriman. The procurement measures that you just stated with the state, will it allow us to still have authority to place kids where we need to?
I believe so. At the end of the day, we will see what the state's procurement goals are. I think they have signaled an interest to try to assess the entire marketplace, if you will, of providers. We don't know if that will be limited to providers in the state or if that will be national. We do use some national providers that offer special services or at times have capacity that we need to utilize as well. So we're going to wait and see. And if the state has a process that meets our needs, that might be great for us. We might need to augment that process depending on who they bring back as providers, or we just may decide that they're either the values that they're bringing back in terms of what they'll pay providers or restrictions on it may not line up with what we want to accomplish. So we're going to assess what they ultimately approve and make a decision about whether that will work for our placement needs.
So those are good words, but the end product is our kiddos, our babies, and so I'm a little hesitant for us to just go down that road. It's always good to listen and observe and hear, but I think that the ultimate placement of children should remain in our hands, since that's where the oversight is going to be. If the state should take it over totally, is it just during an administrative type thing? Will that change if when the terms change and all that? So I just want to make sure that we're keeping.
To the chair, definitely agree with you. We shall be placing children. At the end of the day, I think our hope is that if a state does a procurement and is able to structure deals with providers that are, I think, either leveraging the state's purchasing or its procurement process, that could be advantageous to us. But at the end of the day, it's a county person getting on the phone with a provider, finding out, is that the right placement for a child? I support that continuing under all circumstances. Whether or not the contract was negotiated by us or negotiated by the state is, to me, It's an administrative matter, and I don't think it should have to be one way or another. We have state term contracts that at times we buy services off of, and then we have our own contracts that could purchase the same service. So I hope it's in that spirit that we'll explore what the state proposes. But when it's 10 o'clock at night and we have to place a child, I expect a county worker to pick up the phone and have a range of options available to them to be able to make the best placement available. And they place that child based upon their needs, and that provider is able to meet the needs.
Sometimes funding reimbursements can cloud our judgments of looking at the reimbursements that we'll get, letting the state have control. So we just want to make sure that we're doing our due diligence, because we're the ones that actually go into the homes and remove the children, correct?
That's correct. Absolutely agree that, number one, we want to draw as much reimbursement as possible. I just want to acknowledge both Marcos's engagement with providers has helped, but really it's the fiscal team in DCFS led by Kathy Starks and Dan Bosta. They're really driving to increase reimbursements where possible, understanding what if there are any caps or ceilings at the state, can we try to maximize those caps and ceilings, trying to look for additional reimbursement sources in all of our services. This is a major focus of ours starting last year. It's going to carry through this year, and we are absolutely trying to draw as much reimbursement as possible.
In terms of the contract that is before us, as I spoke to you as well as met with Director Jacqueline Fletcher of the Department of Children and Family Services regarding these concerns that were brought to our attention at the last committee and last year regarding a specific vendor that is in this master contract. And it's one of the residential group homes for kids in the county's care. And there were several complaints. And just want to state that over doing my due diligence, when you're in this line of work, there are a lot of providers that we utilize across the state, and all of them have had some allegations to some degree or not. Maybe it didn't go to this level, but that was looked at to make sure there was equity and not just penalizing any one specific group home, or for the community to think that this doesn't occur and it only occurred with this specific provider. These type of things happen. We have a state process that looks at all of the legalities and investigates, and then we have an internal process as well to follow up and make sure that our kiddos are safe. So from the administration standpoint, I've been assured that steps were taken to ensure that this home has met the compliance standards required by the state, as well as our internal agency. I'm not totally confident at this time, but we will move the contract forward. What I am requiring is that the residential home in question please provide this committee with a written plan of correction of what they did in those two incidences. And this is not to say we don't agree with the processes that your department took to go about and give us your assurance. We still, at the end of the day, have oversight and want to make sure that our kiddos are safe. So if you can get that to me by February 25th, which is the next council meeting, we don't have a problem with passing this out of committee on second reading suspension. But if you think there will be a drawback, the next one, we could go second reading, and then it'd be March 11th. What is your call?
So I'm going to invite Director Jacqueline Fletcher up. I would want to get her input on this as well. What I'm hearing is you'd like to hear what the written plan of correction was for the provider where there were some past allegations.
Correct.
I don't know all the details of that case, and so I don't actually want to assume there was a request from the state that they develop a plan of correction.
But
So
we
this,
should have required one.
well, again, these are allegations that were made against a provider, and, you know, and I think there's a process that goes through when an allegation's made, and a provider has an option to kind of share its details. So I'm going to ask Jackie if she would like to share any just reaction to the request that we produce this written plan of correction for the two incidents.
Good afternoon, Jacqueline Fletcher, Director, Children and Family Services. Just a quick reminder, anytime there is an allegation of suspected abuse or neglect, particularly when a child is placed with a third party, sort of, you know, in a foster home, a group home, even with those that are providing care via teachers or things like that, we have a special investigation unit that goes out to investigate any allegations. And again, it doesn't appear that there were any substantiated claims of abuse with this particular entity. So there wouldn't be a corrective action plan that was correct, that needed to be put in place. But I'm not opposed of following up with the provider to provide you, the council members, any written expectations around their monitoring. We do it. We have monitoring and oversight. I think you spoke to that, Madam Chair, around any time we're placing kids in an out-of-home care setting. We are doing our due diligence to make sure that that care and support is being followed. We're conducting regular on-site monthly visits. Sometimes we're doing more than monthly visits with the providers, looking at progress reports, ensuring compliance with the state guidance and expectations, looking at all the licensing standards and any certification that's required for that particular vendor license. So again, we can follow up and have something to you from the vendor specifically if you want something in writing from them.
Because there was some steps that they did, whether it was letting a staff employee go or whatever the case may be. We need to be vigilant and see that. And I also truly believe that even though the state makes determinations, we as an agency can also, even if we don't agree with the state, remove children from a care. So just want us all to feel a little bit more comfortable on this. So I do get it that we have individuals in this other individuals in this contract versus this one that's in question. So we don't want to hold and belabor that, but we also want our assurance. So again, I ask, do you think that'll be, it's better coming from you than us asking. February 25th, we can move it out of this committee for February 25th with the hope that we'll receive that before it gets passed. Is
Way
that
before.
any?
I'd like to make a motion for second reading suspension.
Second.
Okay, moved by Sweeney, seconded by Castleberry. All in favor, please say aye.
Aye.
Don't go nowhere. So that is done, but I do have some miscellaneous questions. Let me just. Okay, so I figured that we would just put it in miscellaneous business in terms of, so we can be clear. So we're going back to the contract that we had a couple of weeks ago in terms of the behind payments for November and December. So there was one that did not get paid, and they had turned in their stuff. So we just want to be clear, and since this is a master contract, we found out you have to come back to this committee. It cannot be done to Board of Control. Do you know when you'll get those new contracts or up before this committee? Because we were able to pay the one vendor because they could move funding over, because two providers didn't have their stuff together, but we know that's still going to come before us.
Marcos Cortez with Health and Human Services. Actually, there's a simpler process. It does not
Okay.
have to come before council or board of control.
Let us hear this process.
It's called a cover modification.
Cover modification?
Cover modification, or we call it cover mod. And what we do is we move money from those two vendors that had not submitted their final documents and still have not submitted their final documents to the vendor that needed to get paid. That is currently with purchasing, and that is approved administratively through the Department of Purchasing.
Yeah, I understand that, but still, when these two other vendors need payment, because it wasn't, that amount wasn't included in the first initial contract, so how will you,
So Amendment 10 extends the time and adds additional funding. That, all that money is part of that whole contract, so that money is still available to be moved around within that contract. So,
that's gonna cover the two providers that didn't have their, when they finally get their
yes,
stuff in?
yes.
It's not gonna, so, I guess to be clear, the one that got left out, the money was still originally in the contract, is that what you're saying?
No, I'm not sure. I think, so when we submitted Amendment 9, it was based on what we knew, what we had to pay. This vendor was, I think the way they're coded in the system is why we didn't see them originally in SACWIS, the state system. So when we do the new one, it does add the full value of the contract. It will potentially be, you know, that 100,000 that we do owe this current vendor is not included in that additional amount. But, you know, the way the contracts work, we can move it around. You know, this is our estimate of what we need for 2025 and the first part of 2026. So we can move money that we had earmarked in 26 back into 25 to cover any shortfalls that we might have.
Don't plan on coming back?
We do not plan on asking for any additional funding.
Okay, any questions to that? All right. In terms of, one other thing, in terms of the contract updates, has the process started for all of the contracts to be given a 15-month?
Yes, this Amendment 10,
Well, I know this one is,
Yes.
but I want to just make sure, confirming on the record, that all of them will be moved over to 15 months.
all of the Health and Human Services contracts, we have not done that, no. But if that's a request, we'll have to explore that.
That's, was a request in the meeting, so I'm just verifying. David?
Yeah, I just want to clarify one point on that matter. I think the 15-month time, that 15-month expectation were for contracts that were expiring in December, so that no contract will expire in December. Just so we're clear that not all contracts in DHHS, there's over 200 contracts, need to go on 15 months. Just those service areas where there's a December expiration, we want to address that. We don't want any of those contracts expiring December.
Can you send me a list of which ones those are?
Yes, we can.
I will say, this past year, the contracts that did expire at the end of the year, they were approved in November before they expired. This was the only one, of my
Does it
understanding.
matter, we go on to 15 months? Any,
I had a question.
Councilman?
I had a question through the chair. This might be for Mr. Merriman, actually. Sorry to make you keep getting up and down. You had mentioned that we are going to have some new providers. To those of us that are newer to council, can you just give us a refresh on what the vetting process looks like for these new providers?
So I think throughout the year, and I'll let Marcos and Jackie chime in on this as well, throughout the year, as we identify new providers that either offer services that aren't currently met by the existing provider inventory or the existing contract list, or they're new to the service, we are able to identify them, we're able to reach out and see if they're willing and able to take a placement. On occasion, we do find that there's a vendor that has a service that we need, and we place the child and immediately add them to the contract after the fact. So they are not expected to go through the same RFP that we went through in the past. We bring those and formally amend the contract, but then they do have to meet our internal expectations that they're licensed and they're able to provide services. I don't know if Jackie would want to add anything to it. And this happens throughout the year, every year. There are vendors that drop off, and there's vendors that are added. And I think we just want to maintain as full an inventory of options as possible. And that's, so the two vendors listed here are new vendors to us. Anything you'd add?
Yeah, no, just to confirm exactly what Director Merriman said, any new vendor would still have to meet our county requirements to be added to the contract. So what the state does, you know, they're going to procure vendors, most likely they're the vendors we already have. It'll just be different rates potentially. We'll add them, we still have to add them via our process. Even though the state has vetted them, they still need to be included and meet our requirements to be able to be part of our master services agreement.
So through the chair then, again, is this based on specific need? Let's say, for example, you have a medically fragile child, right? And that particular child needs a specific service, but perhaps we don't have a provider that can offer that. What is the process then to identify said provider to say, this particular need exists? How do you then seek that provider out?
Thank you for the question. Oftentimes, we're, as directors across the state, are sharing those needs with each other. So there may be a provider or a vendor, maybe in the southeast region or somewhere that's practicing and doing fantastic work that we don't currently contract with. We'll reach out and get that information. So we're sharing those resources with each other. And I think the state's efforts to look at a statewide procurement is really to help us all understand where those services are being provided so we can share those resources.
I guess I'd like to add that one of the bigger service areas where we've seen growth and really that responds to our need is a lot of our children are experiencing medical issues that require both a medical treatment modality as well as a behavioral health treatment modality. I think we've had kids with developmental disabilities that also have very serious diabetes. And in that situation, you know, we might be able to find a provider that can offer the support for diabetes or a provider that can also offer support for developmental disability, but finding somebody that can do both can be very complicated. And, you know, if we can find that provider, we want to get them under contract, you know, for a placement.
So through the chair, what role does, let's say, the school district play? So if a student has a 504 or, you know, some other type of, perhaps an IEP, is there an overlap in terms of services provided? Because I know that there are requirements in both entities. So what overlap might exist in those spaces?
Most of the time, our education providers are at the table with us doing the case plans to help us understand where those needs lie and how we can best meet those needs in terms of a housing setting, in terms of a school setting, placement setting. So we're communicating and planning with our educational providers consistently. So.
From you guys? Hearing none, this meeting is adjourned.